But just to give you a bit of a background, cancer, I think is a dreaded disease, and our aim at Apollo is not just to treat the disease, but ensure a great quality of life for the patient as well. Apollo has been at the forefront of leading the fight against cancer for 35-40 years now. Started with many accomplishments to its credit. The first cyber knife in the country, the first proton center, which is in Chennai, which is really the pride for the whole entire nation, and several other accomplishments to its credit. And our endeavor has been really to go out into the community and make the lives of people much better. And even in Karnataka, we've lived up to that legacy. Back in 2006, we started the first comprehensive cancer care center with Imperial Cancer Center on Banagata Road, right? That was, and several firsts to that hospital's credit. The first true beam Novalis technology that was introduced in the state back in the day, several years back. And even today, whether it's the cyber knife, the latest cyber knife which we've installed in that hospital, or the CAR T cell therapy which we recently introduced, or having a large organ-specific surgical oncology program where surgeons perform organ-specific, they specialize in organ-specific surgeries like breast surgery, gynec oncology surgery, urology surgery, neuro-oncology, because this is the day of specialization. So all these accomplishments point towards the fact that we are not just here to treat patients, but really treat them with the best technology that we have, with the best clinical sets that we have, and some really groundbreaking innovation that has happened in our hospitals, not just in the state of Karnataka, but across the country. Today we have gathered here, thanks to some wonderful work that Dr. Jayanti, who's our lead breast surgeon for the whole state, and she has done some exemplary work using a robotic technology, the first nipple-sparing mastectomy that she has done, to give a new lease of life to women or men who face or who suffering from breast cancer, and not just doing it robotically. The interesting part of this procedure is a novel use of a titanium implant, which is used as a mesh for breast reconstruction. As I said, not just to treat breast cancer, but also to give a high quality of life to breast cancer survivors.
Hello everybody, I'm Dr. Jayanti Tumsi here. I'm a lead and a robotic breast surgeon from Apollo Cancer Center in Bangalore. Today we had this meeting for a very unique topic wherein there is a technology which has been first time used in India. This technology has already been in use for more than a decade in Europe, in certain parts of America, in Taiwan, Korea, China, and in many, many other countries. But for the first time, this technology has been introduced in India. So as we know, the incidence of breast cancer is on rise, and in India, about 48% of women who develop breast cancer are very young. And the way we treat these young patients is very different from what we would do for an older patient. Now, in young patients, there are unique issues that they come across. Now, though the incidence of breast cancer is on rise, the cure rates are also increasing because of so much research has happened. There has been such advancement in treatment that these patients who develop breast cancer get cured, and post-cancer they have a long life to lead. So, especially in a young patient, we have to also look at giving a good quality of life for them and not only treat the cancer because they have a long life post-cancer treatment. Now, in young patient, some of the situations are such that to clear the cancer, we have to remove the entire breast. Now, you can imagine if there is a young woman, many of them are not even married, if their breast is removed, it has a very deep-rooted psychological negative impact on them. Their self-esteem is lost, and we've also seen that there could be interpersonal relationship issues because the breast has been removed. Now, to address this technology has been used, wherein we have done a robotic nipple-sparing mastectomy. That means in these patients, through a very small cut which is done below the underarm region, it is almost an invisible scar. Through this, we introduce the robotic arms, and with the help of robotic arms, we can precisely remove the entire breast, but keeping the healthy skin and the nipple intact. So the skin and the nipple is of the patient originally, which belonged to her. Only within the skin, the entire breast is removed with a small cut using the robotic arms. Now, once the breast is removed, there is empty space there, the volume is lost, and that has to be filled with something. Now, traditionally, we were using certain kind of flap surgeries to fill this volume. Now, what are flap surgeries? We would take muscle and the skin from some other part of the body and put it inside here. So other part of the body means it could be from the back, which we call as latissimus dorsi flap, or sometimes we use it from the abdomen, which is called as tram flap or a DIEP flap. Now, doing these surgeries means there is an additional cut either in the abdomen or in the back. It's a long cut, the long duration of surgery. Patient has to stay in the hospital for longer time. There is pain associated, there may be blood loss, and at the end of it, there may be what is called as flap necrosis also. To address these issues, we have brought this technology for the first time in India, wherein after doing a robotic nipple-sparing mastectomy, we have used a material called TiLoop, which is a titanized polypropylene mesh. It is a very thin mesh which is used to cover the silicone implant, and this is introduced through the small cut through which we have done the robotic surgery. Through that small cut, we fold the implant and put it in, and then we open it. Now, using this, the surgery has become shorter. We can give better appearance of the breast, which is in symmetry with the opposite breast. And even the inframammary fold, what we call, is kept intact. And we have seen that the patients are very satisfied, recovery is very quick, stay in the hospital is also reduced, and most of it, the outcomes are very satisfying to the patient. Thank you very much.